Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to go over the 3 causes of carpal tunnel syndrome. Carpal tunnel syndrome is when the median nerve in your wrist becomes irritated. Now, that nerve supplies your thumb, your index finger, and your middle finger. And if it is affecting those 3 fingers, that's typically what we would consider carpal tunnel. Now, if you have numbness or tingling in your ring finger or your 5th digit, that could be another nerve, because there's 3 nerves that supply our hand. There's the median nerve, which is the carpal tunnel nerve. There's the radial nerve, and then the ulnar nerve. And so they're going to have different distributions, but typically a person that has carpal tunnel syndrome, they're going to have numbness or tingling in their thumb and index finger. They may have weakness or pain in the wrist as well. In our office, how we would determine if you have carpal tunnel syndrome is we're going to do an evaluation of your neck, your elbow, and your wrist. And one of the tests we're going to do in the office is called pinwheel sensitivity test. So I'm going to demonstrate what that looks like and what a person that has carpal tunnel is going to experience with that. So this is called a pinwheel, and what it does is it just checks the sensitivity to your hand. So when we run this over the right hand and the left hand, what we're looking for is, does a person have a decreased sensation to the pinwheel, or do they have an hypersensitivity to the pinwheel? And that could be an indication that there is a nerve issue going on. So Renee, I'm going to have you put both hands out like that for me. I'm going to run it over the right hand and then the left. And what I want you to do is I want you to let me know if you have any difference in the sensation. So does this feel the same as that?
Yep, feels the same.
Okay. And let's check your ring finger. Any problems there?
Same.
Good. Let's check your index finger. Any problems there?
Feels the same.
Good. Now, if she had carpal tunnel, say in her right wrist, and I run this over the right index finger, she may be like, I don't notice that as sharp as compared to the left. And that would be an indication that that nerve is possibly being irritated. Now, that irritation can be coming from 3 spots. And so we're going to go over those 3 spots now. So the most common cause of carpal tunnel syndrome is actually in the wrist itself. So that's where the median nerve goes right through the wrist here. And a lot of times that's when someone is on a computer with their wrist hyperextended or even flexed down too much. That can cause some compression and irritation over time to that carpal tunnel nerve there. So a lot of times with a surgical procedure, they'll go in there and they'll open up that carpal tunnel space there to give it more room to move around with less irritation. In our office, what we'll do is we'll use laser therapy over that carpal tunnel area to reduce the inflammation, and then we'll also do some muscle work to release some of the tension around there. And a lot of times that will relieve a lot of the carpal tunnel syndromes. The other cause of carpal tunnel syndrome is going to be in the elbow area. There's a muscle that runs from your forearm to your elbow called your pronator teres, and underneath that muscle runs the median nerve, which also is the carpal tunnel nerve. So what a lot of times will happen from being on a computer all day long and working on a mouse, that muscle will get tight just mousing all day long, and or just regular forearm work, that muscle can get really tight. And what happens is that will compress on that nerve, and then that will give you carpal tunnel syndromes. You may think it may be coming from your wrist, but a lot of times it actually is coming up from the pronator teres in the elbow area. So in this area, what we'll do, again, we can do laser therapy to calm the nerve down. We can also do dry needling and active release technique to help massage out any of that tightness in that area, so it reduces that stress on that nerve. The third cause of carpal tunnel syndrome is actually going to be compression of the nerve where it exits out through your neck. So a lot of times what we'll have is people will come in with carpal tunnel syndrome. We will check out their wrist, we'll check out their elbow, and they don't have any issues there. So then the next thing we'll look at is the neck. So what can happen is that carpal tunnel nerve actually starts right here in the base of the neck there. And if there's some compression or irritation going on to that region, that can give you carpal tunnel-like symptoms. So again, the treatment, what we would do is we would do the laser therapy around the nerve where it exits out through the neck. And then we would work on the muscles around that area to reduce that irritation and compression. And then we do some adjustments and spinal decompression to take the pressure off of that nerve. One common misconception we have is we have patients that will come in and they think they have carpal tunnel in both hands. Very rarely do you actually get irritation of both carpal tunnel nerves in the wrist or in the elbows. More often when you have irritation to the nerves in both hands, it's usually coming from more of a central source. What I mean by that is the nerves that supply your hands come from the neck area. If you're experiencing carpal tunnel syndromes in both hands, I would often look at the neck as the source of the problem. There's probably some compression, maybe a disc bulge or herniation, or just nerve or just a pinched nerve in the neck that could be causing that irritation. And a lot of times once we treat the source of the problem, both hands get better. So again, if you're having carpal tunnel in both hands, I would get your neck evaluated to make sure it's not an issue up in that region there. So those are going to be the 3 causes of carpal tunnel syndrome. If you have carpal tunnel and you want me to get evaluated, give our office a call at 703-912-7822 or schedule online at novacarewellness.com.